All right, good morning. I'm going to do an ABG. So the first thing I'm going to do is check the patient's chart, especially the medical history, to see if they have any, or if they're on any medications or a history of bleeding longer than normal. So when I'm ready, I'll enter the room, knock on the door, I will wash my hands, I'll check the patient's ID band, assess the patient, check all their vital signs and everything before I begin. Then I'm going to tell the patient what I'm doing. So I'm drawing an ABG, so that's just going to measure out the oxygen level in the blood, and if they're on oxygen, that way we can see how their treatment is going, if it's raising the levels or if it's causing more harm. And so when we are ready, then we would tell them that we're going to have them extend their arm, and then we'd have a tissue paper or something underneath the hold and extend their arm out, hand out like that. And so when I'm ready, I would place on my PPE. I wear gloves, I could wear a mask, anything like that, just in case if there's any blood splashing or anything like that. And before we do an ABG, we do a modified Allen's test. So we would occlude the ulnar and the radial artery. And so when we do this, we'll have them do a fist 3 times. And when they open up, then we'll notice the flushing of the skin, see how long it takes. And if it's negative, then we would do the other arm and check the flow. And when we do a modified Allen's test, and when they release the 3rd time, we would release the ulnar artery and hold on to the radial so we can see the pulse, if it's a strong pulse or not. And then always try to do the non-dominant arm. And when we find the good arm that we feel that would get a good blood flow through there and it has a good pulse and everything, we'll get everything ready. And so here I have an alcohol prep wipe, and I'm going to take it and I'm going to clean off the area where I'm going to take it. And if the patient is feeling a little nervous or something, we can have somebody help us kind of steady their arm, so that way I don't puncture myself or I don't puncture them in the wrong area. And when I'm ready, I will remove the cap off the needle, and I have it at the set desired area, and then I'd have the bevel facing up, and then I'd have it at a 45-degree angle like this. And so then I would palpate the radial artery, and when I'm ready and I feel the pulse and I feel I have a good spot, I stick it in, and then I will watch and make sure I get to the appropriate flow. And when I get to the appropriate flow, I will take my gauze and I will place it on there. And then be careful not to stab yourself when you do that. And then you take the needle and you would put it into the stopper here. You'd push it down and it curls it, and you dispose of it. So I'm gonna do a scooping method here, and I'm gonna take that off. Suppose that we have removed it here, and when it's removed and disposed of, then we would place and make sure there's no clotting in here. We can do it onto a clean gauze, and we'll place this safety cap on, and then we would place it into here, into our biohazard here, because it's blood sample. And then we would take our label and we place it on top, and we make sure the patient's name is on there, their temperature, room number, and then we'd write down what tests that we did, and then ventilation, if they're on room air at 21%, or if they're like on a venturi mask, and we would put the percent of that. And we send it right away if we can, and if you can't send it right away, then we need to place it on ice until we can get it to the lab. And so we will place a Band-Aid on once the bleeding has stopped, and then we would instruct the patient to leave it on at least 4 hours. And so when we are ready, we clean up everything. I would remove my PPE, and then I would reassess the patient, check their vital signs, reposition them, ask them if they're feeling okay, make sure they're not feeling lightheaded after doing a blood draw. And then I would go wash my hands and chart on the patient's charts and let the doctor know that I got that ABG for them.